So what time is it where you are? I can't remember.
So for us in New Zealand, it's 10 in the morning.
Well, good morning, everybody then. And good evening for those of you who are up late. I know, as I said, I've got a few students actually, where my students come from. I think we've now got over 15 different countries I work with. So the time zones have been rather a juggle, as you can imagine, to get everybody together. So I'll just, if it works for you guys, I'm just going to introduce myself. I don't know exactly what Lynette has shared with you. So I'll just give you a quick rundown to what I do and who I am and why Justine suggested I come on your call. But I'm very grateful and honoured to be part of your team right now, and looking forward to. I've watched some of the webinars that she's been doing, and you guys have had some great people on this. I mean, seriously, some good practitioners. So from my perspective, I am a trainer with, I have a school called the Academy for Hypnosis, and we're an approved school with the American Council of Hypnotist Examiners and also the Dave Ellman Hypnosis Institute, Hypnotherapy Institute, so the DEHI. The school is, I would say, fledgling school, really, quite new. It wasn't something I was going to start, but my own teacher was very encouraging. And I don't know if any of you know this chap. His name is Dr. John Butler. Some of you may have traveled to train with him. I know that he has people also around the world. And he, after a while, was incredibly encouraging. He said, "Come on, Sharon, it's time to make a school." So here I am. COVID hit and I thought, well, it's a good time as any. And so we started a school which is partially online, and very shortly I'll be doing some live demos back in the UK, probably in Chicago and wherever else I get invited to. So if New Zealand is on the cards, I don't mind coming over. My husband and I are pretty cool about coming. I mean, we really want to go. I've only hit Australia, so I haven't gone as far. I mean, I have been to Fiji, but not, I missed out New Zealand. So
it sounds awesome.
It would be absolutely our pleasure to come over. So one of the specialities that I work with, and I say specialities because, as all of us know, as we're hypnotherapists in the room, I guess, we all have, I'm sure that most of us are working in multiple different directions. You know, the age-old question is, you know, what does hypnotherapy do? How can it help? And if you sort of say everything and anything, then it's sort of kind of, people go, well, that doesn't make sense, you know. And I just say, well, look, if you're involved in it and your brain's involved in it and your body's involved in it, then there's somewhere it's, you know, hypnosis is going to be useful. But in terms of then moving into a particular area, a particular niche, I got into the medical and dental niche really through Dr. Butler, in fact. It wasn't something I was particularly thinking of. It was actually during my own training. John was teaching or preparing rather a client for a hernia operation called for a live television show called Hypnotherapy 5 Live, and it was this client would come into our course to get sort of a little bit more, I suppose, activated in terms of his feeling of being comfortable in doing hypnosis in front of a live TV audience. So that's how I kind of got involved, or sort of learned about the medical dental side of things. John was a real advocate for this particular niche area himself. Anyway, as soon as I had finished my course, I happened to be with a friend who happens to be a colorectal surgeon at one of his surgery parties, his surgery friends, and they all came up to me. And even though my friend said, "Don't tell them what you do," you know, don't shh, you know, it's all hush hush, you can't tell about hypnosis. But they'd all watched this hypnosis on 5 Live, So they were all really curious, you know, well, we want to do that. We want to do that. And I thought, God, I've just literally studied, I've just learned. So I spoke to John and I said, John, I have a whole bunch of surgeons who are interested in learning. And he said, well, why don't we teach them then? And I thought, okay, since they, you know, he was very sweet, my client, sort of my clients, my referrals, I suppose. And so we set up something called the Institute of Hypnotherapy for Medical and Dental Practice at the time, and started teaching surgeons, anaesthetists and dentists, which was really fun. We were accredited by the Royal College of Surgeons, which is the first time a hypnotherapy course has ever been accredited by the Royal College of Surgeons. And I obviously got to learn a huge amount more had I sort of been shadowing Dr. Butler as well all this time. But my own practice was flourishing and I was doing well in irritable bowel syndrome and many more of the, let's say, the dental and medical side of things as well. I really, really enjoyed that sort of, you know, particular niche market. So, and that included hypnosis for childbirth, all that kind of stuff. Yes, I tended to get emergency clients for emergency situations in very difficult situations medically. And I don't know whether that's just because I was excited about that and that's the sort of energy I put out, but that's what I was getting. I was getting incredible experience with emergency medical situations. So being called into hospitals at all sorts of hours. And John and I started doing tours where we were teaching, you know, medical dental people, but I sort of branched off into the dental with him in a way we sort of, it's an easier market, let's put it that way, especially in the UK. So we started filtering ourselves into the dental market. And one time, and I've got the video if you want to see it, there was a live demo that we were to do of a phobic patient. He'd not been to the dentist in who knows how many years. He needed to have a filling. He didn't want to have anesthetic. And then I had another female who wanted to have a filling done, no anesthetic. So I was supposed to be the one chatting to everybody in the audience and telling people what's going on, because this was in a dental show. And the dentist would be carrying on doing their job. I would be doing my, you know, telling the audience, and John was supposed to be doing the hypnosis. Well, John phoned me that morning and he sort of phoned me a couple of times that I can't get there, I'm later, I can't meet you. You do the first one. So I was like, okay. So I'm standing in this booth, this sort of sterilized booth with my dentist, my dental nurse, the patient who I was absolutely shocked he'd show up. I mean, because this is a phobic person, so the fact he showed up to me was beyond belief. And now this was from scratch. He'd not been hypnotized before. There was no prep. So that was also my own little, you know, come on, Sharon, give yourself a challenge. And did the procedure, went very well. And the next lady was to come, and I'm phoning up John. I said, John, where are you? We've done one. Are you on your way? Are you on your way? And he was I can't get there. I'm really delayed. So I had to do the next person. And again, it was in front of a huge, now the audience is really getting big. And the woman that had the procedure was so excited. She got up and started taking the microphone around and asking everyone questions, because I couldn't do this myself. And it was just fascinating. It was a whole jumble experience. Anyway, after that, John turned around to me, and as a true mentor, he said, right, you're ready, you take on all the dentists. And I went, wow, that was putting me into the fire, and which I thought was amazing. He really trusted me to do that. And I felt, it felt, you know, very special to be said, okay, that's it, you're ready. And so from there on, I you know, through that actual experience, I got lots of phone calls. I got invited to teach at a place called Portsmouth Dental University, which is part of Kings and Guy's. So I'm their regular teacher there, but also other practices. It sort of flourished from that point on. So you might want to ask some questions or just interact and see, and if I can try and find that particular video.
Yeah, I think it'd be awesome watching the video. and seeing
I'll
what
have a
you
look.
do. That would be really cool.
Let's have a look. So,
So
yeah,
is
if you've
it-
got any questions.
Yeah, I was going to say, is there anyone here in New Zealand? I know Marissa wants to specialise in, that's her goal. Is there anyone else here that's working with people for dental and medical stuff?
I've started to do more and more people in this area. And this morning I was contacted by a friend in Australia with a young woman who's got a brain tumour that is too difficult to operate on. So she's lost a lot of weight. So she's going to be my next port of call. Yeah.
Is she too difficult to operate on because they don't want to give her any anesthesia or something?
I don't know all the details. I think it's risky. I think that's the reason they don't want to do it.
Okay. Sorry, yeah, I'm just trying to find this thing.
I just would like to share that when you were mentioning the woman who went through the procedure and she passed on the microphone to everyone, I have been in that experience, very similar. So unfortunately, Andrew is not here today. I couldn't see his name on the list, but he prepared me to go to a dental procedure without anesthetics. I had about 6 teeth and quite deep fillings. And he gave several suggestions, and one of them was that time was going to compress. And I was there for 1 hour and 15 minutes, and I felt like I was there for 5 minutes only. And when I got out of this chair, I rang him and I said, Andrew, it went perfect. And then I continued explaining to him how I felt and what happened. And then all of a sudden, all the patients waiting were looking at me. So I had to look at my clothes thinking that I had dropped something. And then it came to my mind that I was in a state of euphoria. So I left the room. And I also I tried with Justine, I got partially into the Eastdale state. And then I tried with other hypnotherapists, and I can get into that state very easily. So I would like to help other people because I really feel like in my heart, it is something that I should be doing.
Yeah, I've been doing a bit of stuff with chronic pain and IBS patients, but I have currently got a client who's got a severe dental phobia who I'm working with. So I'm hoping to get some fabulous tips and things from you today, Sharon.
Let's see what I can do for you. I mean, I love Marissa's story, actually. I think, and this is the first tip, June. The first tip is follow Marissa's lead. The best thing that you can do for anyone who's got any feeling around a dental or medical procedure is when you go into a dental process, do it yourself. Self-hypnosis is to me, the winner. When you feel that you're completely at ease yourself in going into any of these procedures and experiencing what it's like. So Marissa will have experienced multiple levels of trance state during that time. You get to understand what your client's really going to experience. So for instance, I got some videos of me having my wisdom tooth taken out with no anesthetic, and then I'd had another one done, and the second time the guy said, oh, we're done, and I was like, oh, great. And so I'm done, and he goes, I've got to put the stitches in now, and he starts doing stitches with no hypnotic state. And so I can tell what it feels like to do it with or without hypnosis as well. But it's these kind of little things, the nuances, that I think if there was ever a top tip to give, that would be it, is make sure that you do this yourself. Get comfortable yourself. It doesn't matter what level you get to, doesn't matter what depth of trance you get. In fact, it's even more important that you feel all the different states that you're probably going to, because that's exactly what will happen with your clients. That way, when you go to give to your client, whether they're phobic or whatever has come up, because many of you've probably done all sorts of different phobia release or whatever people tell you to do. I don't know, there's so many different techniques, ideas, etc. But most importantly is your frame of mind as the hypnotist, and also your conviction in you don't actually need to have anesthetic if you don't want it, because most of it is needle phobia. Most of it is needle phobia, or it's the fear of pain, or it's the fear of being out of control. I mean, well, hypnosis is going to cover all those bases. So, you know, just say, well, I tell you what, because sometimes you just don't have time, especially if you go into surgery with somebody, you just don't have time to deal with the psychoanalytical points and issues. So I said, well, don't worry about it. You're going to do this without any anesthetic, and I'm going to show you exactly how to numb yourself right now. And because you're going to do that, whatever phobia you had in the first place, gone. And so yeah. I want you to concentrate here. This is the focus. Do this focus here. So you can change things about very quickly, and you can explain, well, the brain is now learning to readjust and repattern itself. And everybody I've worked with, you know, whether they've said, oh, I'm so, I mean, even the most phobic, I'll show you, I've got the video up. Let me just put it up on my desktop, and then I'll see if I can show you, because it's the most important thing with a phobic person is whether they show up or not, whether they show up to your session or whether they show up to the dental chair. Either way, neither of those are down to you. Because if they don't show up to your session, it doesn't matter what you try and do, they're not going to be there to do anything with. And secondly, if they don't show up to their own, you know, dental experience, you still can't get in there, you know. But if they show up, that's it. They've gone past phobia, and they're now into high anxiety. And that's a difference. You know, when I teach dentists, I say to them, hands up, you know, who has phobic patients, and you know, all of them put their hands up. I said, well, no, you don't. They don't show up. I mean, that's first and foremost. A phobic really won't come. I know phobic people, friends of mine, and they won't have me help them either. So yeah. Right, let's and you know, it doesn't matter what, as I say, it doesn't matter what we do. So let's find this for you. 1 second. So I'm just going to screen share this for you. And if, you know, I'm happy to have you watch a few videos, because they're quite good to bounce off and chat about as well afterwards. Come in and sit down and relax, because this is a very relaxing experience. We're doing hypnosis for dentistry, and we have a patient called Matthew. He's never been hypnotized before. This is a live demo to have hypnoanalgesia. He'll be having a filling done without any anesthetic.
Are all patients hypnotizable, or are there some that are not?
Personally, I've never had a problem hypnotizing anybody. Are you ready? Yep. Good. Good. I work with people with special needs, Alzheimer's, you name it, I've worked with them. Do they want to go through the process of being hypnotized is a different question. Relax and just go deeper still. Relax and go deeper still. Relax and go deeper still. If any of you can see Matthew's eyes, he's got what's called the rapid eye flicker, which is a very good sign that he's in already choosing to go into a very good state of relaxation and a hot hypnotic relaxation. You can see the whites of the eyes, which is very, very normal. So he's an excellent subject for hypnosis.
How long time would it take to acquire the knowledge to hypnotize patients?
To learn how to hypnotize, we teach people in a day to be able to hypnotize and understand. In 2 days, they can be able to do an extraction, no anesthetic, that kind of stuff. Good. Anna's looking after you, making sure you're doing well.
I'm looking after him.
And Richard's doing a wonderful job.
Open just a little, Matthew.
That's it, relaxing. Good.
So I just want to ask, for a first-time patient undergoing this hypnosis, if they've got coming in for a fill-in or anything, how much longer do you need to add on to the treatment time to get them in a hypnotic state?
It's patient dependent. Children are incredibly fast and they're so compliant. Good, well done.
I mean, I'm always somebody that's, whenever I've been to the dentist, I know I'm going to get anaesthesia through a needle, and I'm petrified of needles. So, you know, from today, that's it. I don't care what I have done, there will be no more needles. It's hypnotherapy all the way for me, not just in a dental chair, but all of my friends who are pregnant, I'll be encouraging them to get hypnotherapy when they have the babies, because I don't see the point in having the anaesthetic now if I don't have to.
When you're doing the hypnosis, are you still able to sort of ask for, you know, bits of equipment and talk dentistry to your nurse and stuff?
Absolutely.
Or does that get in the way of
Not
putting
at
the
all.
patient in a
In
trance?
fact, you use it. The suggestions are so easy. The thing is, the one thing I want to get across is you do this all the time. You talk to your patients. You asking them, relax your body, feel relaxed, feel comfortable with yourself. And now I'm just going to speak to the nurse. Blah, 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 blah. Pass me this, pass me that, pass me the other. And now relax again. Good, that's right. Simple.
We've just done quite a deep filling. I know it didn't take me terribly long, but it was actually quite deep. And he's fine. He wasn't even wincing.
Could the patient tell everybody how he feels at the moment?
Yeah, please do.
Absolutely fine. The mouth is completely back to normal. Fine.
Were you aware of the numbness?
At times, and I was aware of you doing stuff, but it was just something that was happening. I wasn't really paying attention to it.
It's pretty good going, I would say, for a high anxiety patient. Wasn't really aware, just relaxed and got on with it.
Okay. So that was a little snippet of that was the day when John left me in the lurch.
Hang on. Beautiful demonstration.
Thank you, I appreciate that. I have to say, when I said come in, relax, everybody, this is relaxing, I was a nervous wreck. I'm like, where's John? But no, it was an exciting day. So if you are interested in going for this kind of thing, and you know, I encourage it. I think personally, I think this is the most fun of all hypnosis, if there's a fun factor. You know, go into these kind of experiences where you go to live demos, and first, obviously, you need to hook up with a dentist. Richard was fabulous. I had a great time with Richard. I've got quite a few patients that he sent me. I sent him. Unfortunately, a couple of years ago, he had a stroke, so he no longer is working. But I mean, we had a great time. And you know, you have to find a dentist sometimes that's willing to go the extra mile with you for no extra pay, no nothing, just because they believe in you, and do a live demonstration in front of thousands of other dentists. And you know, just hope that everything's going to go all right, you know, without embarrassing him as well. But you know, getting, as I said, you know, get to know your local dentist. You know, June, get to know the dentist that your patient is interested in. That's also a huge factor. I've definitely had problems in many areas where I've walked into dental practices. I don't know the dentist, they don't know me, they don't know what I'm doing, they don't understand it, they don't like it. I'm treading on their toes, they believe. They haven't quite seen the benefit because they haven't seen it yet. And you know, they interrupt the process quite frequently. I had my very first patient, who's on here, didn't video it unfortunately, but my very first patient, the dentist was nudging and saying, are you all right? Can you feel any pain? Tell me how it hurts. Tell me. And he was doing this to her all the time. And it was at that moment that I thought, I have to teach dentists. I cannot ever do this again, where I'm walking into a practice. Well, I have done it again. I've done it multiple times, unfortunately. But I have had many occasions where the dental practice has not been on board, and even if they've been on board, they still make let's say mistakes. There's a wonderful clip of a girl on here, a woman on here rather, that I work with in the UK, and she had a very special dental procedure needed to be done. So I had a bone graft and all sorts happening, and she didn't want to use any anesthetic. And Richard, the chap you just saw, he recommended a particular dentist who happens to work at the hospital where Queen Elizabeth attends. So I thought, well, he should be pretty decent. know what he's doing. Anyway, when I met him, he just kept saying, is the client mad? Is my patient, is she mad? She doesn't want to do this. And I said to her, well, no, she's not mad. She says that she has an allergic reaction. No, you can't have that. There's no such thing. I said, well, you know, my patient feels that that's what's happened. You know, you can't go against what they say. My patient says that's what's happened. So we'll just go along with it. But I'm going to do the hypnosis. And he said, well, we need an anaesthetist to stand by. And I said, well, I know this client is going to be very good. I knew it because she was coming all the way from Ireland over to mainland UK to do this. And I thought, well, if you've got a client who's that motivated, it's going to go well. So I had a camera team on hand, and the dentist said, no, can't, we don't want that. And such a pity, because it was one of the best experiences I'd had, and with so many nuances that happened in the process. And at one point I said he had, you know, cut into the gum at some point. He was doing something, and then she's, you know, a lot of blood. And I said, do you want her to stop bleeding? You know, always ask the question, don't just go straight to that with my patient, because obviously sometimes the blood is needed there to wash the wound or to clot or whatever they need to happen. So I said, do you want, and he goes, well, yes. And I turned around and I said, turn off the tap, stop the bleeding. And there it went, stop just like that. And the dentist looked at me and goes, is this magic? And I said, no, this is hypnosis. I really couldn't get him to understand, but he was a lovely chap. In fact, I started writing a book, and he really advocated. He said afterwards, he said, we should have filmed that. And I said, no kidding. And then he said to me, he's in his 40 years, he retired recently, and he's in his 40 years of being a dentist. He said that was the best experience he'd ever had. So, you know, you can really make a difference to some, and to some dentists it can be quite the opposite. It's sort of, you're treading on my toes, don't come in, you know, this is what we do, and you're in my way. And that's another thing you need to be careful of for those of you who are getting into the dental realm, is how to talk to your client, sometimes sitting on the other side of the room. I've worked that one out too. You need to get earphones and a microphone hooked to you that goes straight to their ears. Because sometimes they don't want you near them. So there's lots of little things that, you know, top tips, if you like, I can give any of you if you're interested. But for me, I think my passion is really about teaching the dentists, because once they've got it, once they understand, and I said in that clip, you know, it takes us about a day to teach. Of course, you all know it can take 20 minutes to really learn how to go into a hypnotic state. It takes days, weeks, and months and years to become proficient as a good hypnotist. But then that's down to, you know, the hypnotist, the dentist themselves. So does anybody have any questions from that? And would anybody like to see anything? I can give you some clips if you like, because they're quite fun to watch. I've got some clips with a wonderful kid called Jesse. I think he was 15 and he had 4 teeth extracted, no anesthetic. I've got my own self-hypnosis with just for one. I've got self-hypnosis for wisdom tooth fillings and another wisdom tooth another day. But I've got plenty of things I could show you.
Self-hypnosis, please.
Yes, absolutely. Let's see if I can drag that one up. Would that be acceptable to the team? Everybody here?
I also would like to ask a question about the dented.
About the?
Yeah, so I noticed that you touch their head and you move to the left, to the right. Is there a specific purpose to do that?
That was just a rapid induction.
Okay.
Yeah. Have most of you do rapid inductions, or are you doing, what kind of inductions are people doing?
I don't have any,
saying no.
I don't have any experience touching their heads for rapid induction. So if you could explain what happens, it would be nice.
So a rapid induction in this way, this was the type of induction that Gil Boyne did. So John Butler was taught by Gil Boyne. I don't know if any of you have heard of Gil Boyne. We have some nods, maybe not. So Gil unfortunately passed away again a few years ago, and I was very fortunate to train with him, and he was John Butler's teacher. And Gil did mostly, he wasn't really into what we'd say the medical and dental field. That was John. But he was really into, he created something called transforming therapy, which is a fascinating way of using hypnosis for analytical hypnotherapy. And he introduced it with Gestalt work and Virginia Satir and Fritz Perls and Carl Rogers and, you know, Albert Ellis, all these greats. And he kind of combined all this incredible stuff, including Dave Ellman, because Ellman's work was pretty much the first person, I think, that really understood regression work as a process, to take it into a process. Dave Ellman was a process man. But so Gil Boyne had sort of worked on that. And again, he uses the Ellman technique or the Ellman element, which is exactly what I did there, but to do it with a rapid induction, which would be more stage hypnosis as well. But you want to loosen the occipital nerve. You want to just create this feeling of relaxation, and you've just, you know, given them a click and that's it, you're down, done, right, let's get on with the job. I mean, I'm into a no mess kind of thing, no messing about. Let's get on with it. We've got dentistry to do. You can't sit there doing any long inductions. And that's really why Ellman was so fascinating. Have we got any nods that we do Ellman here? Any Ellman technique? Great. So that's why Ellman was so fascinating, because he'd seen, taken from stage, the good elements of how to make this fast, why making it fast, what was important. Well, the medical and dental industry were not interested in hypnosis with these lengthy inductions. It made no sense. They haven't got the time for it. And so a good rapid induction will get you there very quickly. I mean, as you saw, it's a couple of seconds really. So pretty much all my dental inductions are rapid inductions. It's the shock effect. You've got the shock, you've got the loss of equilibrium, we've got the relaxation head roll, and you're there really. Do an eye catalepsy, hand drop, if you like, whatever, and you're done. So it's a super fast induction. I recommend you all learn a rapid. In fact, I created a rapid induction for my school online. How do you do a rapid induction over Zoom? So I actually invented a rapid induction over Zoom, which is kind of a weird one. I'm not going to go into it because you know, I don't practice that one enough, because Ellman can get you there just as quickly and just as well without people losing balance. Let's see if I can find, what were we looking for? You asked me for a self-hypnosis.
There's also a very interesting question there about going out of hypnosis halfway through. I found it fascinating. I don't think it's possible. What do you think?
What was the question? What do I think of?
Wait a minute, it's there. Have you ever had anyone come out of anesthesia?
Yeah, me.
Yeah, that's the question that has been asked. Did it?
Yes, I came out. It's common. Just don't be afraid of it. It's okay. I mean, you know, doing medical and dental hypnosis, you've got to really respect the fluid state of trance, and that includes the fluid state of sensation. And when you are aware of that fluid state of trance and sensation, you can still work with it. It's not a bad thing. I mean, you just feel it for a second or two, and then you go, oh goodness, I don't want to feel that anymore. I'll go back into hypnosis, because that's the way the brain works. It's like, well, hang on, we're right in the middle of doing a job here. So, I mean, some of the hypnotherapists you may have heard call it superconscious, which I guess is a good term in a way. So you have the subconscious mind, which you're addressing, you've bypassed the critical faculty of the mind, you've hit the subconscious, blah, blah, blah. But then the superconscious is that part that's knowing of, you're in the middle of a procedure, better to stay there. And yes, it does. This is why I find dental and medical so fascinating in the first place, because people want to stay in that state. I came out of the state during a procedure. A few times I've actually come out of it during procedures, and I've gone, quickly get back in. It's not the way you want to be, and that's it, straight back in. And you can tell when clients do. So the woman that I just mentioned to you before about with the very let's say, the very posh dentist, very, very upper crust. We're all Mr. and Miss and Mrs. and whatever. It was all very formal. When you get to the Queen's Hospital, it's very formal. So it was rather amusing. But the dentist, this is when people don't know what you're doing. I had got my client, she was in a good state. I'd seen her once before. I knew everything was going to be hunky-dory. I didn't have a problem with her at all. I had no stress about her coming in. But I turn up that morning to the hospital, and she's looking at me and the tears are rolling down her eyes. And I said, hey, what's going on? What are you crying about? And she said, he's told me he's going to do it in order of pain. And I went, oh, that's interesting. I said, well, I have to just let you know, when you're in hypnosis, there is no order of pain. When you have a scalpel stuck through your gum, that's it. If it doesn't hurt then, it's not going to hurt. That's it. I said, you will feel some pressure if you're getting teeth taken out. And that is something else. You can see that in my self-hypnosis. That was quite extraordinary, the pressure. I said, you can feel pressure, but pain, there is no order of pain. The brain won't compute that. By the time we get to notch, so she was happy with my explanation. By the time we get to tooth number 3, I think it was, she starts to come out of this state, and you can see the panic starting to rise, because here is her order of pain. Doesn't matter what I've said to placate that message, it's already started to bubble up. So she's getting that again, and I can see her. So I said, okay, just drop down now. And I use the word drop a lot in hypnosis. I say, when I use the word drop, you go 10 times deeper. So when I use that word, so drop, and then she goes straight back in. You know, it's a great little message. You don't have to work too hard. And she went straight back in, and effectively that could have been the end of it. But again, superconscious plays a part. No, it's not the end of it. You can still carry on. But you see, you just never know. You never know what's, you know, what a message can be given. In my own wisdom tooth extraction, well, actually, I'll let you watch it, and you'll see the mistakes and tell me if you spot them. How about that for a giggle? I'll just bring this one up for you. 1 second. Right, let's turn me on. There we go. Let's share the screen here.
Many dental operations and tooth extractions now with many of my clients. I've never actually experienced one myself, and I know, you know, the best way to empathize with all my clients is to experience it myself. Having a wisdom tooth unexpectedly come down and it didn't actually surface completely, I thought, well, this is an opportunity to use hypnosis for myself, and I don't think I would have had it any other way.
You are going to do all your own self-hypnosis induction, meaning I surf your ride.
Don't tell me what you're doing or how, no. But if you say to me, let go of the tooth.
No, that's taken for granted.
Okay, just say, okay, let it go.
Basically, when we take it out, I don't want just enough blood to form a blood clot. I actually want enough blood to flush it.
Oh, okay.
Okay?
All right.
And then I'm going to say to you, okay, it's flushing, keep the flow going, as it were. Now you can stop at a point, right? And then we'll wait until it effectively forms what I call the gel clot, like a jelly plate.
Yeah.
It's like a jelly plate.
Yeah, no, I've seen it on patients.
So, I'm sure.
Yeah.
So, and then of course I've got to put that little stitch in. And if all goes well, you'll only need 1 stitch.
Michael's brilliant because he's worked with me on a number of occasions, and he's also an advocate of using hypnosis for tooth work. He's done many surgeries and things without anaesthetic himself, and he allowed me the chance to kind of lead into the sensations by using a probe to begin with. And when he was using this particular probe initially, he continuously used it. Apparently he was going harder and harder with it, and it was exactly the same sensation as the first time he put it in the mouth, which was a lighter probe. And he said at number 9 it would have normally been caused most people to have jumped out of the chair, and he knew I was absolutely ready.
Doing good. You're all right up to this point? That's good. So the next little story is we're going to do the ultrasonic cleaning bit that goes directly underneath the gum. There is water accompanying it, so we will have to have some suction going. Okay. So you're right. We're going to now make our little first primary incision. Okay, so yeah, that's it. As you're taking yourself down lower and lower, right? And are you ready? Here we go. So I'd like you to put your head up and back like that a little bit. Yeah, that's good. And to turn slightly towards Irene. That's good. Okay. So you come across me this way. Yeah. So. Yeah.
Surprisingly, the easy part was contending with the sensations. I didn't feel anything. I mean, I literally did not get involved with any of what would be considered painful experiences or painful sensations, which looks really weird because the thing that really got me that wasn't easy was the pressure.
Now we're just going to open this up. Yeah. A little bit of pressure pulling us out of the way.
Yeah. It was so unexpected. Michael, the dentist, Michael White, had said to me, "You're going to feel pressure," and he really tried to emphasize how much pressure I was going to feel, but nothing could have prepared me for this pressure. Nothing. The actual cutting of the gum, the moving of the tooth, all of those things. They were not what I would consider what would normally be considered painful. They just didn't feel painful. I was so surprised.
It's a lot of pressure because I have to just get it to leave it. Yeah. Would you like me to put the anesthesia?
No, it's not hurting.
It's just a question of getting at it because of the little angle leaning into the tooth. I've just got to get around that angle. Once I've got in under the angle, then I'll be fine.
I've seen other patients working through the pressure experience, and I've been there holding their hand or scanning their body, and in many cases just using touch on the body, touch on the leg or on the stomach, just to give them that kind of reassurance. And actually I noticed with myself, I really wanted that. I really noticed, I really wish there was a me next to me. And I just thought, this could be great and I kind of put my hand up for the nurse, and I knew I didn't want to grab it or it wasn't to hold tight. If you notice on the film, I put my hand up. It's actually very floppy, and it was just to have that sense of, oh, okay, I'm okay, you know, I'm back. It's sort of like coming out of one's body and then coming back into it and saying, yes, I'm grounded again. I can see how having either the nurse be involved in that experience or a hypnotist be involved in the experience can make a big difference.
It's coming, it's out, it's out. Here we are, it's done, my dear, it's done. Okay, now, just give me the forceps, I'm just using a pure forceps to just take it out. It's out, it's easy for me to get it this way, okay? Well done. Okay, just get a cut, please. Put some water into it. Okay, so here we go. Just let it flow, that's fine. I have to tell you the good news is, remember I told you about the little flap? It almost perfectly closes it down. It's incredible. Look, it looks neat, I tell you. Okay, so now we're going to just put the suture in. Thank you very much. It's quite difficult because this is the area, so I'm sorry, Sharon, I've got to pull your cheek out just so I can see properly.
In terms of pain, zero. Even putting the stitching, which was actually my fear, was like putting tooth floss.
Right.
So that even didn't, I was like, oh, it's just like flossing your teeth.
This is much better with much finer control. That's better, that's fine. That's it. And everything's looking just super duper fine. And now what you can do perfectly is to stop that blood flow completely, just there for the meantime. Yes, just stop the blood flow. Only in that area, stop the flow. Anyway, the good news, it's all out in one intact piece. The second good piece of news is that the maxillary tuberosity around the back there is quite fine bone. It's clean, absolutely clean. So you're all right like that.
You're the right guy to do this kind of job.
So there you go. See, completely clear, nice little flap all closed over there. And of course, see the cheek, no bleeding, no nothing. And that's all up to you. You've done it all. Well done.
Thank you so much. I feel really relaxed. I'm really glad that I'm able to stop the blood. You might notice I put my hand up at one point to say stop, first stop the bleeding, and because Michael has said you need to stop it now, and I just went to myself again, stop, and it stopped. And I'm really pleased I have that ability. I've got to, at 7 o'clock, so in about 5 or 6 hours, I've got to then start to let open the capillaries and let the blood flow change again. Knowing that I can do that is lovely, to have some sense of control over one's own body and senses, because it's not just for this moment. I mean, it's for anything and everything in my life. It's a proof to recognize that mind over matter is completely possible on every level.
All righty. So, thank you. Everybody spot the issues there?
Yeah, he was hypnotizing you to feel pressure. That's
one thing. Did anybody else notice anything?
I was just mesmerized by the whole thing.
So one of the things he said, I said to him, just don't tell me what you're doing. Does anybody remember that? He spoke the whole way through.
Yeah.
Told me everything he was doing. So I had to combat that conversation, plus use the hypnotic state throughout the whole procedure. So there was a big challenge for me there. On the other hand, I quite like it, because then you know exactly what's going on for the film. So that's kind of useful looking back on it. But there were moments. I mean, that was a 2-hour procedure.
Oh.
There was one point there where he said this will be a difficult piece, or a bit difficult, but so he used the words telling you it was going to be difficult.
Yes, I mean, he was quite surprised, because the pressure was really intense. I mean, because it was pushed to the back, and it was lodged against, you could see it was lodged against another tooth. So he wanted to peel it away from the other tooth, and still had to, when you take out a tooth, what happens is you have to push up. It's a bit like press down really hard so something can bounce back up again. And that's, once it's all loosened around the edges, they push, and then it comes. In that situation, he couldn't push down straight or up straight where it was. I can't remember now. I can't even know where it was in my mouth. It was in one of my teeth. He pushed really, but he couldn't really push too hard, because it was at an angle, and what it would have done would have scraped against the other bone, well, the root of the tooth, and therefore would have destroyed the other tooth. So that's why it was way longer than a normal wisdom tooth. My other wisdom tooth operation was so fast in comparison, but on that situation I had a dental friend and the dentist, and they couldn't stop talking to each other about how excited they were, and I just thought, well, I really have to get on with this. And so again, I was in another situation, and they were so excited it all finished. As I said, they'd be like, yeah, it's finished, and I hadn't finished at all. So yes, some things they don't always go to plan, and I think that's one of the things I find quite fun as well, you know, quite exciting about this particular area of hypnotherapy. I mean, nothing really goes to plan, I suppose, in hypnotherapy anyway, but I don't know if we have any plans actually. Has anybody ever had a plan in hypnosis? But, you know, you do find that everybody's experiences are different, and your own included. But yeah, top tip, always do it yourself first. Get used to it. So, and Marissa, I really hope you filmed your experience.
No, I only got the statement from the dentist that it was done without anesthetic. So I didn't record it, but it was fascinating, really was.
It's worth recording whenever you do these things, even if you're only going to the dentist for a hygienist experience. It's sometimes worth recording what's going on, just because if you want to get into this line of work, seeing is believing. Well, I say seeing is believing. My first dentist, after the teeth were extracted, he turned around and goes, I'm still not sure I can believe it. So seeing is not always believing, but mostly seeing is believing. I was like in despair. I was like, you've just taken the teeth out of your client, no anesthetic, and you still don't believe in hypnosis. I was like, I don't know what to do about that anymore. I was just like, that's it. I can't figure that one out. Does anybody have?
Oh, sorry. Do you see your clients before they go into a procedure, whether that's surgical or dental? Do you see them beforehand?
I like to. I do think the outcomes are better if I do. I have a lovely, again, I mean, you're all welcome to go on my YouTube channel. It's just under my name. There's a lovely video of a woman at somewhere called Covent Garden Dental Spa, and I'd never seen this woman before. And so it was like directly, and this practice only ever has me come in on the, you know, off the fly. It's like, Sharon, we've got a patient, they're coming in tomorrow, can you come by? Okay, I'll see what I can do, or can you bring them in a week's time, a day's time, whatever, you know. But I don't get to see them, I don't get paid, they're not going to pay me to see them beforehand. And there was this lovely woman, and she had a total fear of the dentist, and she said, I can't stand it, I can't stand the noise, it terrifies me. So, you know, one of the things that many of us use in hypnosis, let all the sounds take you deeper. That's, you know, like a standard almost. And I said, well, just let all the noises take you deeper, and imagine they're playing like an orchestra or like a music, like a band. Imagine that every sound is, and I was just, you know, going off on my own little wander. Anyway, I didn't know, another royal moment, I didn't know that she was the musician for Prince William's 21st birthday. And so she just thought, you got me, and you got me, you knew how I am. And she was so happy that I had told her just to use it as musical instruments, and that was the end of it. So that was meeting her immediately, straight away, no problem. Gag reflex I've done. I had a very difficult experience with a woman who was heavily pregnant, needed an extraction, didn't want anesthetic, and that was also at that particular dental practice. And the dentist who was doing that I'd never met before, and I think they brought this particular person in as a special, which meant that they weren't on board with what I was doing, whereas most of the practice was. And I saw this woman, and the dentist, she said to me, you need to come with me quickly. And she takes me into another room, which has a window into, so the patient is sitting in the dental chair, quite terrified, going to do this with no anesthetic, heavily pregnant, which means, you know, that her pain sensors, everything is, sensitivity is really at a heightened level at this point. And this other dentist whisks me out of the room, closes the door, even though there's a window there, and she starts going, we can't do this, this is impossible. And I'm thinking, oh my gosh, this poor lady in the room there can hear this, see this. The dentist is totally freaking out, and I'm just going, yes, she can, and you'll be fine too, and everything's going to be lovely. And I'm sitting there going, oh my gosh, you know. And so those moments are not ones I particularly encourage anyone to experience, but they happen. So yeah, I see that there's a ton of chats in the chat room. Is there anything that perhaps you'd like me to answer, or is there anything, or are you just chatting between yourself?
There are a couple of questions here that I'm just reading. I imagine you are paid by the client, not by the dentist. That was the last question.
So yes and no. That particular dentist that I just mentioned, I'm paid by the dentist, although of course it goes through the client and the client pays the dentist. And I talked to that dentist about them getting a finder's fee, if you like, for a better word. And so therefore we kind of split, you know, as long as I get paid what I'm meant to get paid, I don't, it's not up to me how much they want to put on top of that as part of their income or whatever. I don't have a special room or a special chair to do anything extra with my client. And if they need any, let's say, analytical therapy work, it has to be done in minutes to get over some of these issues. I mean, we're talking about minutes. You know, like, you're done, you finished that issue, come on, let's go. Or your mummy daddy stuff, it's all done. So,
and the same person, Faye, she asks if you have had any other work done besides the wisdom tooth.
For on myself?
Yes.
So I've had fillings and I've had the wisdom teeth, no anesthetic. I've had lots of burns because I'm quite clumsy. So I'm always giving myself hypnosis for my multiple burns. I've got lots of little scars which have healed up very quickly and you don't see them anymore, which is brilliant. I've used hypnosis for, I had 2 spinal operations and I used hypnosis not as the sole anesthesia because they wouldn't let me. And they said, look, if you breathe in the wrong place, you're already at 50-50 whether you're going to be able to walk again or not. We do not suggest you use hypnosis. However, I had the hypnotherapy MP3 running through my whole surgery, so pre-op, peri-op, and post-op, and I never used a single painkiller, no morphine, nothing. And I was up and walking around very quickly, so quickly that the spine hadn't healed completely. And I sneezed, fell on the floor, and needed another surgery in 2 weeks. But they were so blown away by my recovery rate. And when they say, you know, the research is, when they say that there's the recovery rate is 6 times faster with anyone using hypnosis, whether that be with anesthesia or as a sole anesthetic. It's true, it's definitely true, and you'll find that with every patient. So yeah, so I've used it for a gynae operation, and I had a gynae operation, and I didn't particularly want to do it without anesthetic. I actually thought, you know what, there are certain things I'm happy for them to do, and I'll go home somewhere else. But when that was complete, it was meant to be an overnight stay, and I finished the surgery about 8 o'clock in the evening, and I said, right, I'm done, I want to go home now. And they said, well, you can't go home, you just had a major operation, you've got to stay here. And I said, what am I staying for? And they said, well, we've got to give you painkillers. I said, no, I'm not in pain, I'm not going to have that. I said, so what do I really need to stay for? I said, well, you really need to stay until you can pee. And so that means the anesthetic has now moved on, so the intestinal system is functioning again, etc., the whole, you know, the bowel system, etc. So I said, well, if I can pee, can I go home? And they said, well, if you can. So of course, what do? I sit on the loo, I use hypnosis, go to the toilet, come out, said, right, nurse, I've peed, can I go now? She was like, oh, yes. You know, so I walk out, but I actually, even after it was a major gynecological surgery, I walked home from the hospital because I fancied a walk. So I just thought, get a breath of fresh air. So I was like, I'm home, I'm done. I just want to go into bed, and that's it. So, and I did that with a girlfriend of mine as well. I said to her, she was having a very similar operation. I said, look, if you do this, I'm going to do hypnosis with you pre, peri, and post. She did it, and I said, and we're going to walk home from the hospital, and we did, and it was perfectly fine straight after. So, you know, it can be done. So yes and no. I've used it a few times with no anesthetic and a few times with, and one of the things I must say is this is not to become a hero to do everything without anesthetic, and nor do your clients don't want to do that either. most clients will want to use anesthesia, and they want to have hypnosis as an adjunct to that procedure, and that is perfectly acceptable. So you can lessen the anesthesia just by saying, well, rather than general, let's go to a local. I mean, I always look at it this way. Millions of women are having major abdominal surgery with a local anesthetic through cesarean, and nobody seems to bat an eyelid about that. So I can't see why most of our surgeries can't be done with local anesthetic, because our recovery rate just from that alone is better. So, you know, that's food for thought. Anyway, it's another way that I sort of encourage my clients as well.
There's another question, from Annette. What about children, and what is the youngest age you have worked with?
2.
Wow, lovely. And another question from Faye. Why do people...
Wasn't that lovely, Marissa? It was very complicated. It was 2 twins, 2-year-old twins, and they get in the dental chair, and the first one, absolutely good as gold, does what they need to do, needed some fillings, I mean, you know, and pops out the dental chair, turns round to the sister and says, this is going to really hurt. And then, of course, then every time, and I'm using the pocket watch, because I often say to kids, how do you hypnotize? And they go, oh, you watch, you've got a watch. And I say, so I'll bring out the watch, and I do the pocket watch. And it was like, every time we try and get it to this direction, then the drill's got to come on this direction. So they're looking over there, and we get it done. And then he goes, I don't want that. So every time we do, I don't want that. I don't want that. But he did actually, he went, yes, you do want that. It's fine. So, yeah.
So the general anaesthetic comes with, you know, so much more risk. And I think that the general anaesthetic personally is more for the surgeon's benefit. Would you say, perhaps?
I think it's really important. Everything has its place. I think it's really important that we're given options.
Yes.
Definitely that we're given options. One of my colleagues who actually works with me he does all the filming for my Hypnosis Academy, and it was a really strange thing occurred. We had a woman teaching about cancer and breast cancer. because I work sometimes at a hospital called down in the south of England and they have a unit called Breast Friends, and that's for men and women with breast cancer. And I said to her, would you like to come in and teach my students about breast cancer, so that when they have clients, and it's so common, that they'll know what to do. Anyway, she does her talk, she does everything, and then the next day my colleague says, you know, I just went to the doctor, I've got breast cancer. And this particular colleague, he was born with spina bifida, and he has a very truncated torso, so his body isn't the spine is fused, and multiple problems. And they said to him when he was because he had to have a mastectomy on his chest, and they said to him, we're really worried about you, because when we put you under anesthetic, we're worried that you might stop breathing because your chest is so compact, and we need to make sure we get oxygen to your brain, and we're worried about starving. And he's looking at going, well, I don't want the anesthetic then. And they laughed at him, and he says, no, you don't understand. I work with a medical anaesthetist, hypno anaesthetist. We can do this without. And I was coming to the UK. He was in the UK at the time I was coming. I could have done it with him. They absolutely point blank refused. And he was furious, because that put him at risk.
Yeah.
And they were literally putting him at risk by using anesthesia. Yeah. And that's what gets me annoyed, because if somebody turns around to them and says, I have another option, and this will mean that I believe I can do this, and if I can't, please go ahead and anesthetize me, whatever you need to do, or sedate me, or whatever. But he was furious, and he actually wrote to the hospital and says, I never want to be laughed at again when I ask to have something for if I need a serious operation like that. He said, because of his physical disability. And to me, it's tragic. It's tragic that we're not out there in that capacity. As I say, there is a place for everything. As I said, I didn't really want to know what's going on in my gynae operation. I didn't really want to see who was looking. So I'm happy, I'm out of it. But I would have done my back surgery. I absolutely would have done it. But because the surgeon was like, look, don't breathe in the wrong way. We're right by your nerves and your spinal cord. I was like, okay, I'm okay. Again, don't need to be a hero about it. But there was
I had an emergency cesarean with my daughter, and I remember in the end that they put me, I had a general anaesthetic, and I remember sort of really scared and panicking, saying, am I going to be okay? And I remember the last words they said to me before I went under was, there's a risk with everything. It's like, I was lucky I even woke up. If I'd have told myself what they told me, they just, as a hypnotherapist, you don't say anything like that.
I mean, yes, it's there's
I remember it, so you don't forget that stuff, do you?
No, there's a lot to be learned. I mean, when I started talking about doing this work, and I was giving a lot of lectures and I was going to business networking events and getting clients and things, I remember I was just telling people about using hypnosis for surgery, and one woman came up to me and she said she had had an operation. She was told everything was going well, but then she kept feeling this really bad feeling inside herself that something wasn't right. So she approached her consultant afterwards and said, look, you say that the operation went well, but I just don't feel there's something in me that doesn't feel right. And he said, oh, it's funny you should say that, because whilst you were under general, we saw something, we saw a mass, we took it out, we did a biopsy and it was all right, but we were concerned at the time. And that just shows you that we absolutely can hear whatever's going on. But obviously there was no conclusion to what she had heard necessarily. You don't know what exactly you're going to hear. It's a bit like if you fall asleep at the television, which you don't really know what energy, what's coming at you, what messages are being given to you. So you hear some and not others. And so that was the case with her. So, it's true, we're even in a waking state or in the under total anesthesia. Not good.
How have you found working with surgeons? Because we had a doctor, I just can't pick up what his name was. We had a doctor talk to us from California last year, and he was mentioning how doctors are starting to become a lot more familiar with hypnotherapy and the benefits of it. But his comment was, but if they're a surgeon, forget it. And I do know surgeons tend to they're a breed of their own. But how have you personally found working with surgeons? I know you work with the patients, but correlating that with the surgeons, their attitudes and things.
Yeah, well, it's a mixed bag as anything. You're right. I mean, there's we're God. There is, we do a good job here, and so surgeons save lives, and imagine saving. It's interesting. If you saved one person's life in 10 years, you'd be over the moon. You'd be like, oh, I did something, I got them in time, and I caught them from, flying down a pack of stairs or something, and you'd feel so good, or whatever it would be. You'd be over the moon. Well, these people are doing this day in, day out, 1, 2, 3, 4, 5, 6. And so I can see why there's a particular, like you say, a breed of their own. There's an energy around that. There's such a high level of not only stress, but of I don't even know how to say it, of we're doing something amazing every day.
And responsibility, because they know people are putting their lives in their hands.
Absolutely. I mean, it's a, knowing some surgeons, it's a balance, and you'll get the few that are interested. They tend to be more interested when a group of people are interested, because they don't like to be seen as the woo-woo one, which hypnosis is woo-woo. I mean, there's a lot of research now. There's a guy called Mark Jensen. I don't know if any of you have heard of him yet. Dr. Mark Jensen, who's British but doing work over in the States, and he's a neurologist who's working specifically in the field of pain management and hypnosis for pain. And so, you know, I don't think they've got enough equipment yet to really identify what happens in the hypnotic state as such. And I think until that point, there's going to be a level of skepticism and fear, because it's not a standard. You can't create a standard with hypnosis and the response. So it's challenging, I have to say, working with it's harder working with surgeons, you're right, than dentists.
It was going to be my next question. Is it more difficult with surgeons than dentists? So yeah, thank you. You answered that too.
I've just been working with a surgeon actually, and he came to me for an issue that he had. So he was open to hypnotherapy. He's been writing a book. He's written a few books, and he's been sending me some of his chapters to his books. But one other thing I found very interesting is with surgeons is that they do go into a light trance state, and they see the work that they do as like an art form. So they're looking at what they're doing as, that's just how I suddenly realized what they were doing. He said surgeons that have to, you know, with keyhole surgery, they have to look at a screen and do things while looking at a screen. So he said that the older surgeons that were doing everything by feel, you know, actually hands in the body and working, found that very difficult because they had a feel for things. So it's quite interesting hearing a surgeon's feedback on that. And I think if you're talking to them about the art of surgery and how, you know, if they're doing yet another liver transplant, which is what he's done and all sorts of things, or you're doing yet another something, you know, they're already in that trance state. So you can kind of lead them through that to bring them to that other place where it becomes, it just becomes more natural for them to understand the process. You know, it's by speaking.
Oh, definitely. But the problem is, what you've got is getting to the surgeons in the first place.
I think they just find you at the right time and place. I mean, I wasn't looking for a surgeon, and then he pitches up, and you know, I'm not looking for doctors, and they pitch up, and then
that's right. That tends to be the way. And but if you are engaged in the idea of just that's what you do, it can be, you know, you get to a point where there's only so many that pitch up, and then if that's your business, then how do you get the ones that don't pitch up?
Yeah, I don't worry about them. I just sort of think, you know, whoever comes is the right one. You know, who wants to convince people? You know, you want them to be interested enough to trial it. I don't know. I just think whoever comes is it's fine. You know, and I quite like working with all these different types of people. It's, you know, all different areas, because it does make it interesting. I have a bit of a thing with blood and operations, so you know, I'm not sure I'm going to be brilliant at that, but I feel that I'm being pushed towards that area a little bit. So it's been lovely to hear your story. It's just been fantastic.
Oh no, keep going, Julie. I mean, you know, I encourage it. You know, don't worry about the blood and the gore. You just you concentrate on their heads and their minds, and you just, you know, I did have somebody came to me and wanted to have an eye operation, and I thought, please don't let it happen. Please don't let it happen. I just did not want to be there for that. And thankfully it didn't happen. So, you know, there are moments, but I had a kid, and I've got him on video. I had this little boy, 10-year-old, absolutely petrified of having his, he needed to have an ingrown toenail removed and done. And he put it off and not done it and not done it. Anyway, so I saw him in my office, and then I came with him to the procedure. And I left him in the room because I actually taught him how to inject himself with the needle. And I said to the podiatrist, I said, just put X marks the spot and let him do it himself. And the podiatrist says, excuse me, you want the kid is 10 years old to inject himself? I said, well, yes, he can do it. Just put X on the skin. And he's looking at me like, that's not that. I said, look, are you going to be with him when he does it? And he goes, well, of course. I said, well, then let him do it. And because he got control of doing his own injection, he then said that he does it. He injects himself, he numbs his own toe, and then he said, Sharon, do you want to come in and see this? And I'm thinking, no, I really don't. I said, come, look. And he watched the whole thing. So going from absolute fear to watching his toenail, but he had 2 done at the same, because they thought, well, why not? We've got to get the other one done. And I'm thinking, I'm going to be sick. And here he is. He's absolutely fine with it. And I'm thinking, I need some hypnosis. And I'm walking around going, but yeah, there are times when it's not all fun and games.
No, maybe I need hypnosis to get over that, because sometimes I have people come in. I remember years ago when I was doing something slightly different, I was running a healing clinic, and someone came in and they started to tell me about how their foot had been run over by a lawnmower, and I could feel the heat rising, you know, like I'm thinking, oh crap, I'm going to faint, you know, like it was terrible. So maybe I need hypnosis to actually get me to the stage that I can do hypnosis in those situations.
Don't worry, Julie. I tell you something, when the push comes to shove, you can do it. You move through it. I mean, I have seen probably sometimes too many dental things that I think, why am I looking? I don't want to look at this, you know, I don't need to. So yeah, sometimes it can be a little bit, you know, if you're of the more squeamish type. I'm definitely, you know, I'm probably one of the most skeptical hypnotists I know. And I'm also, you know, not into blood and gore either, but I just love what happens. And every time something shifts, I'm just like, really, that worked? That's amazing. Let's do it again. That works again. Are we sure? Can't believe it. And then you know, and so every time it's like a new day for me. I have no clue. The one thing that was really interesting was recent when the pandemic came, that I was in Indiana, which is I think it's something like a 4 or 5 day drive to New York. And I had a client who said, I need to have so many teeth out. And I said, well, I can't come because you're in New York, I'm in Indiana, and you know, and that's when I realized that we can do the whole thing on WhatsApp. And I was like, yay, I don't need, but the WhatsApp can be really difficult because you've got somebody who's got their phone and they're sort of, you know, you use catalepsy to have them hold their phone, and they're doing it, and sometimes it kind of drops and you start just seeing up their nose and in their mouth, and that's all you're and you're thinking, no, please lift your hand slightly, and you lift your hand slightly, even more, and then it just goes down again. You're like, I really don't want to see this. So
have you found that, sorry, have you found that dental procedures have actually taken less time than the anticipated amount of time when they've been, the procedures have been done with the hypnosis?
Oh, 100%. It's much quicker. It's much quicker to use hypnosis in a dental procedure than wait for the anesthesia to work to kick in. Much quicker.
And I mean, I just mean just not just that part of it, but just like okay, so I had this experience. I had an accident, and because of this accident I had to have a number of teeth out, and 4 of them were going to be surgical extractions because of the condition of the teeth. So they booked me in for a 2-hour appointment to do this massive extraction, and they yes, I wasn't brave enough to do it without benumbing, but hey. But anyway, I did set up a recording to listen to a couple of weeks before I had the procedure. I had that window of time to do that, where every tooth, as it felt any instrument, it would release, let go, and literally come out. Now I had 4 surgicals that were going to be long and require, well, whatever, and stitches. So I was a little anxious because I don't love dentists. And then the morning that I went in, I thought, oh, I should just make a quick recording to listen to, just like a beach relaxation. And no, I can put in some of my favorite tunes that I like listening to that are wafting across the beach to me as I'm lying there in the sun, whatever. And so I made this quick recording before I went out the door, and I thought, oh crap, it's only 39 minutes long. It's not going to be long enough. I'm going to have to stop the dentist halfway through and say, hang about, just need to reset this, put my earphones back in and carry on. So I gave them instructions that I was going to be listening to a recording. I'd hear what they said. If they asked me to do anything, I would do it. And I was absolutely fine. And all I could hear them saying is, I think she's asleep. I think she's gone to sleep. I think she's asleep. They were talking between them like this. do you think she's asleep too? Yeah, I think she is. And do you know what? Here's the interesting thing. This 2-hour window of time they booked me in, the very last tooth that popped out, and they said, okay, it's done. I heard that. And it was the very last word on my 39-minute recording. They happened at exactly the same time. It was 39 minutes. And you know what? None of them were surgicals. Every single one just popped out, because I said that in the pre-recording that every tooth, and I actually went through and I touched each tooth with my tongue. So, you know, you didn't want the ones that were good to be doing anything. And I thanked that tooth for what I had done. It was time to move on. It was time to come out, would release, let go fully and completely and intact. And every tooth came out fully, completely and intact with no surgicals. And I thought, wow, that was amazing. The dentist said, I've never seen anything like this happen before. And no, I did not record it. So it's just interesting how the mind can actually, it's as if it was able to pre-correlate with the procedure and what was going to happen, that the dentist thought 2 hours, and yet the mind could say, no, it's not going to be 2 hours, it's going to be 39 minutes. And that was my recording, and the last word of the recording and the last, it's all done, what happened at the same time. And my biggest issue, which I had to get my husband to come in and help me with, was actually coming up enough out of the hypnosis to walk out of there. I was so relaxed. And so that's a real testament to me as such, that the power of the mind is incredible, and the power of the mind to be able to work with the body, of course, and to work with even time frames to achieve the outcomes. So
yeah, that's a lovely story. That's so impressive. I love it. Thank you. Thanks for sharing that. Yeah, you never know. You never know.
Those are such inspiring stories that I've heard today, and it just is making me, the question inside my mind is, and it's, sorry if it's an obvious one, it's like, why do people choose to do dental hypnosis without anesthesia? Like, I can understand why people would opt for medical hypnosis without anesthesia because of the side effects, so on and so forth, and coming out, etc., etc. But like, why would people opt? Is it like pain of needles? Is it like, what is it exactly? Is it mind over matter? What have you found is why people opt for hypnodentistry?
Well, all chemicals aren't great if you're going to stuff chemicals down.
Okay, the chemical situation, yeah.
Yeah, I mean, if you look at kids who have had chemicals, right, it's right near their brain. I mean, how do you know? It's watch some kids come out of, there's some great clips on YouTube actually of a kid coming out of his dental procedure, and he's had I don't know what kind of, God knows what they put on him, and he's high as a kite, out of it. I mean, what's that doing to our brains? I mean, look, I'm not, as I say, I'm not against chemical anesthesia, but if we can do things without, because it is healthier for us, and using hypnosis means our recovery rate is faster. It means we won't need any painkillers, which, guess what? There's an opioid crisis in the States because everybody's overdone it with opioids from pain, not from, you know, from I want to be a drug addict. It's because they don't know how to manage pain here. And they go more and more opioids, more and more and more, and you get to a ceiling point where it's now in the danger zone. So there are many good reasons. If you have a drug addict who needs to come, you do not want to, dentists hate working with drug addicts for that sole reason, that they're essentially re-triggering these happy, relaxed sort of chemical systems, which really need to be calmed down and not being re-fired up. So there are many reasons why we don't need it. We just don't need it.
It's a belief. Like, I'm hearing this, when I'm hearing you ladies talk, I'm like, oh my God, like, I think it's a belief that if you don't have it, you would be in pain. And I think for you to either receive it or be the hypno dentist, whatever, in a room, you'd have to have boundless confidence in the procedure and in the process, and in the ability of the mind to keep the pain out. I
have confidence in that part of the mind, which I think is, I mentioned at the beginning of the talk, which is a sort of super conscious. I have confidence in that part of us. I have more confidence in that than, as I say, my skepticism about hypnosis, because I just find it just, it's like, well, even in the hypnotic state, I mean, again, I talk this over with a lot of my clients who come for the first procedure. They come once and it's brilliant. They get things done. The second time, the tears start to come and they're not sure they can do it. And that's a part of the conflict in the mind again that starts to recur. Really? We're going to do this? The first time was an accident. There's no way you can do, it's luck, beginner's luck. No way you can do that again. And then I have to work with them to go, that's just the way the brain works. It's, you need conflict. It's important to have conflict. It gives you an ability to play off and associate what's, give judgment, criticism and doubt. It's important. These are fundamental parts of our human nature. If we don't have them, there's a problem with us. So it's like allowing that conflict to be there and still moving. And that's when it gets really interesting, that second part about going to the next time you do it. And by the third time, you're like, what, I'm actually quite good at this. So the brain sort of kicks in and just goes, well, I'll just do it anyway.
Said something in here, it just reminded me when I had a very bad car accident when I was 16, and I ruptured my spleen and broke all my ribs and a collarbone. So, but what I found really fascinating was I had no pain. The body naturally has this thing that when you're injured, it's that old reptilian thing of being able to get up and get away from the threat. And it's a natural thing. I didn't feel any pain for probably maybe 45 minutes. And then I remember they stuck me on the table to be x-rayed, and then, wow, it was really painful. Boy, was it painful. So I was shouting because everything was all over the place. So, these sort of things, by prepping people to say, oh, this is so natural, you've probably heard or you've had something where you've had to, so it's leading them into this place, which is actually the truth. We have that already, we have that thing, and so we might as well use it. But it's funny remembering that feeling, because I literally, there was nothing. There was
I 100% agree. And if you look at Dabney Ewan, is everybody familiar with Dabney Ewan here?
No.
No, okay. Well, look him up. I'm telling you, all the people that passed away not that long ago. He passed away a couple of years ago. Dabney Ewan was an incredible hypnotist who worked in New Orleans in the burns unit. And the stories that it's one of the things I share with my students is quite a bit of Dabney Ewan's work. And he would go to the emergency with the paramedics. And I remember at one point there was a truck that had gone over somebody, and their leg, they'd gone into the artery and it was spouting blood. And so Dabney Ewan went over to them and said, calm down, stop the bleeding, you've washed the wound, you're fine now. And so he went away to talk to other people. It was a car accident, and he went to talk to somebody else in the car, and then he saw a big crowd crowding around who started freaking out because this car was, in a precarious situation over this other person that had now just stopped their bleeding, and they start worrying around, and of course the bleeding starts again. So Dabney Ewan runs back again and he goes, stop the bleeding, you've done it before, you've washed the wound, you're fine now. But you see, that's what you need when you get to the ER. You see, if you had somebody there who had kept you in that state, Julie, when you were young, you had already got that point where the brain knows what to do. And it does this with animals, by the way. This is a huge thing. If you watch any animal, they will automatically go into a catalepsy when they're being pounced upon. In fact, they immediately go into that limpness to give the subconscious. They don't want to feel anything. You rarely hear an animal screaming or yelping because they've actually gone into surrender pose. And unless they're really going to fight to the death of it, it depends where they're at with the other creature, I guess. But animals will also go into that same place. They also have that ability. We've got this ability within us, all of us, to immediately, you watch any child, they'll fall over, they'll get up and they'll look for the response. And once they've seen the facial expressions or the emotional response, then they're going to identify with how that it should continue for them. So
Sharon, you were just reading my mind. I just quickly jumped on to find something to show people just before we finished up. I found this
I don't want
really
any animal rights fans here, okay? This was a good thing.
Because the minute you mentioned animals, I just went on. I accidentally had my mute off, and I went on just to
if
find
everybody
this.
wants to see it, sure.
I won't show it now, but I just put it up on the screen to remind me. That's really interesting. So you've done it on animals before?
Yeah. I think I'm one of the second people in the world that has done an operation on an animal with hypnosis as the sole anesthetic. The other guy is Dr. Escudero, who's done a lot of work. He initially started as an orthopedic surgeon, then he's now does a lot of maternity work, but he's also, there's a video of him doing hypnosis for an animal, taking a toilet brush out of the dog's stomach. That was a 10-minute operation, you can see that he does. And my operation I did was a 90-minute hernia operation. And what was lovely was I had over 30 students. It was at a research college. And it was obviously very highly done. You'll see that when you watch that video, you'll see that there's a cannula put in, cannula put in, so that if we needed to flood him with anesthetic, it would be. But we measured every single one of his vitals, and oh boy, that was my dream patient. He was chilled and just lovely. He just, as soon as the operation was done, in fact, we could tell when he had. This is coming back to you, Karen. This animal, you could tell when he knew the operation was finished or finishing. It was extraordinary because we measured the heartbeat, we measured the flow, we measured, the vital signs. I mean, they were constantly, we had so many people in the room, and that dog, we started putting in the stitches, and I said, "What? She's starting to swallow now." And as soon as the swallowing starts happening, I'm like, "Look, the eyes are starting to move now," and it was like he was done. And that was when the stitches came in. It was just extraordinary. But I have to say, unfortunately, I have had some animal rights people going, "Oh, this is terrible. How could you do this?" And I'm like, well, I did this with the permission. I didn't just go off and get a dog. It was high research, and I don't recommend for everybody to go do this at their local veterinary office. But I do want to do more research to find out, the responses, because it was extraordinary. And that dog was with its owner, tail wagging within 20 minutes and totally hydrated. And normally, if any of you have pets, it's normally a 4-hour wait till they can get rehydrated and even aware. So the anesthesia for animals is very, very dangerous. So that was important to see how that could be done.
Awesome. Well, today's been massively. Have you got a question? Is that Carolyn?
Oh no, I just wondered how you spelled the Dabney Ewan, the name of that hypnotist.
Dabney Ewan is Dabney. No, Dabny.
Yeah, I think it's Eny.
Is Ewin.
Oh, it's an I-N.
Oh yes, thanks. Thank you. It's Eny. Thank you, Justine.
Yeah, there is a recording on YouTube of him. He's quite a lot older, isn't he?
Yeah. Oh, he's dead now. Yeah.
There's one if you look him up.
Yeah, I was at the ACHE conference a couple of years back, and I was going to see all the really good hypnotists, and it just so happened I was seeing some of these much older hypnotists. I just wanted to go. A friend of mine said, "You haven't seen me yet." I said, "Well, you're not old enough. I'm just seeing the old ones." I just like to go and see all the originals, how they work. They're just fascinating. They just, some of these people are just absolutely brilliant people. They've really paved the way for us.
Justine, can you please put up the link for that?
I have. So in the chat, there's
no in our messenger thing, not on here, because once I close this down, I don't know how to find it.
Oh, so the chat normally goes, if I remember, the chat goes on to our underneath the video, but yeah, I will do that. I've got them up on my screen. I've got the dog one and the Dabney Ewan talking about burns.
I'm very curious about the how to get a dog into hypnosis, since I've got a dog that just freaks out about just having.
Again, well, I was going to say again, I don't think it's this is where I want to stress why I don't think it's a good idea to do this, because I think it's a good idea to use it for surgery, because that is when the animal is needing to go into a catalepsy. It's when the body is in that space that he knows it's going to go towards a healing, or he's not sure. I don't know. I don't know what's going on. But if you keep hypnotizing your animals, I don't know if it's a good idea. This is why I want to do some research, because if you keep putting them into that state, is that a good state? Because as we know, as most of you, like Julie just shared, her brain knew what to do in the moment of crisis. Well, surgery is a moment of crisis for all of us. And so I just be wary of doing this, that's all. And putting an animal into that state too often. Now, I say that, but Pavlov did it quite frequently with a number of dogs over and over again. I mean, if you want to know a bit more about, you can see a lot of Pavlov's work. There's a book about him, the psychological and therapeutic factor, Pavlov. Now he used a lot of hypnosis, but he was trying to find it for the psychological part, and he wasn't thinking about it in terms of that. So, and just as a thought, that's all, Karen. I don't want to discourage you, but we don't have enough work on that yet.
It's just really interesting to see how a dog can become that relaxed in an environment that is so foreign and unnatural for a dog, where they're normally freaking out about something. And so if they can do that in a surgical environment, then just to have that basic relaxation for a dog that's been traumatized or really
I've had it with horses stuck in fences.
Oh, you would too?
Yeah, because these horses are ones that aren't broken in yet. They're basically wild. They get trapped in the fence is going to cut them to pieces, and they just stop. And you see it in videos of people cutting out deer and really aggressive animals, where the animal just shuts down. They cut them out, and then when they realize they're free, they're gone, and they don't look back. Sometimes they look back, but so it is a natural, it's something that happens with all of us. I've had it the same as Julie in a car accident where I didn't feel pain for an hour, and then boom, wasn't very pretty. But yeah, I can understand why you wouldn't want to tamper with it too much, just in case it took away the effect if they really did need it at some point. So,
Yeah, that's, people often say, oh, Sharon, teach us this. And I just think, not yet, not until I actually, in the Midwest, my husband is a professor at Purdue University, and where it's just down the road from us here, and they have a big veterinary school. And so we're trying to get some talks about talking to the the dean of the school, and see what we can do, because it is another factor that is used. Do you know what happened when somebody saw my video and they were a dentist and they know what I do? They said to me straight up, saying, "Oh, this is really good. I bet you could do this with people." So, sometimes you do this stuff and they only just wake up to what you do because they've seen it on an animal. But again, I'm just at that point yet where like you said, I don't know if it's a good idea to be doing this.
I think we find with any hypnotic things that we do, when I try and reverse back to see what's actually happening, it tends to be something that naturally happens in the environment in times of stress, or when you're talking to people that have experienced trauma, they say, I see myself over there. So we tend to be tapping into things that we wouldn't actually do anyway in different situations,
100% agree. I'll just leave you with the last thing, because when I teach my students how to get analgesia, because that's part of my course, I teach them how to create analgesia for themselves. Some of them don't achieve it, and I said, well, that's because you don't need it right now, and it's absolutely fine. So and just to be aware of that, it's not bad if you don't get it. It's just because you're a hypnotist doesn't mean you have to get it that moment, because if you don't need it, why would your brain be inviting it? And some people's does, but you can't rely on it.
Yeah, so true. Awesome. So Sharon, how do people get hold of you? And what we might do is put your school into the chat as well, if you can, especially for people interested in the stuff. And I'm going to share Sharon's YouTube link as well.
Yeah,
get some videos on there.
Let me see if I can do this.
Do you have a book, Sharon? I noticed on
I'd
your
love
website.
to have a book. Why are you going to write one for me?
I thought I saw on your website there was a mention of a book.
There's always mentions of books, but not mine yet. But I am actually creating I created it years ago. I just never did anything with it. I created a book which was a workshop book for dentists. So it was, rather than a book that they have to look through everything, it was actually to help them in immediate situations. So that's something that I have been doing. I think you've got academyforhypnosis.com. That's the website as well, academyforhypnosis.com. And I've often got little things going on. I mean, next week happens to be at this, 4 o'clock UK time. No, it might be different. I'm doing a hypnobirthing or a hypnosis for childbirth with a client, and I'm going to be videoing that and having students come and watch that. And sometimes I've got a whole supervision group that I just sort of say, hey, guess what I'm doing this week, and they come on. And so my students like to meet other people as well. But that's one of the things to do. I also for my academy, I retrain a lot of hypnotists who want to have that a little extra push, that maybe they haven't learned certain things. So and they get a real discount if you're already a qualified hypnotherapist. Because one of the things I hate is you go to somebody's training school and then you have to pay full whack for something you've already learned. And I get annoyed by that. So I thought, if I don't like it, I bet nobody else does either. So I decided to let my qualified hypnotherapists come along, and they get a much cheaper rate to do the whole thing, or portions of it. Because they don't need the certification again, but they can get it if they want to do it, but it's much cheaper. But what I love from them is that when people do come, I say to them, well, look, you know something, and you know something I don't know. So I want you to share with the students and help them as well. So it's a kind of win-win for all of us in that. So, you're all welcome to join. It'd be lovely to see your faces again.
Cool. Well, thank you so much for joining us today. It was inspiring and eye-opening, and lots of people have been messaging me that have been having to shoot off, saying it was incredible and so good to see it.
Thank you. Well, thanks, Justine, for inviting me. And it's a pleasure to meet all your crew over in New Zealand. It's lovely. I think it's wonderful that you all get together. I think it's important that we stick together, we encourage each other. It's so important. Yeah, we need it. We need this for each other.
Awesome. Well, thank you. And thank you guys for coming on this lovely morning.
Thank you.
Thank you, Justine.
Thank you.
All right, guys, I'll catch you later.
Bye.
See ya.
Bye. Thank you very much.